This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center, and I'm going to answer the question about what conditions do ketamine infusions treat. This is a frequently asked question, and the list of things that ketamine treats are quite extensive. So when it comes to the mental health disorders, things like treatment-resistant depression, bipolar depression, suicidality, post-traumatic stress disorder, anxiety disorder, and OCD are some of the more common treatments that ketamine has found efficacy for. Now, ketamine infusions are rapid and robust in their efficacy in treatment-resistant depression, and results are seen within hours to days after the treatment is initiated in depression and depressive disorders. So individuals who have failed multiple other therapies, including regular and traditional antidepressants, even TMS and ECT, have found ketamine infusions to be very effective in the treatment of their disorder. Suicidal thoughts as well and suicidality has also been treated rapidly with ketamine infusions in numerous instances. Ketamine also has found efficacy in painful conditions. And generally, these painful conditions are not nociceptive type pain conditions. When I say nociceptive, I mean like knee injuries, for example, or low back pain. Ketamine doesn't really work well for joint pains that are chronic or even acute unless you're treating the person constantly with ketamine. But rather, ketamine works better for neuropathic pain. And when I say neuropathic pain, it's pain in the nerve terminals, like, for example, post-traumatic neuralgia, which is pain that occurs after shingles infections, and also specific headache disorders like trigeminal neuralgia, cluster headaches, migraine headaches. And then there's things like chronic regional pain syndrome, which also is effectively treated by ketamine therapies, but a different protocol completely. And there's also efficacy with ketamine in the treatment of cancer pain and also chronic fatigue syndrome, fibromyalgia, and phantom limb pain. And that's pain in a limb that has been basically amputated. Individuals will still have pain in the amputated part. The brain still perceives pain in portions of the limb that just aren't there anymore. And more recently, addiction treatment has been found to have efficacy with ketamine treatments. For example, alcohol use disorder, cocaine use disorder, and opiate use disorder basically have increased and improved outcomes with ketamine therapies in specific instances. And especially individuals, for example, who have stopped opiates and opiate use disorder and now are covered with specific medications like Vivitrol and naltrexone frequently will feel depressed and have post-acute withdrawal syndrome. And ketamine therapies can help augment and improve the depression that these individuals have. Cocaine use disorder has been diminished with the use of ketamine therapies, and so has alcohol use by basically ketamine's rewiring of drinking memories, as an example. We mentioned chronic pain being effectively treated with ketamine therapies. Now, again, when I say treated, it's not a cure, it just helps the person manage their pain. And ketamine can augment traditional pain management, so the individual does not have to take as much opiates, for example. And then there's some types of injuries that just don't respond well to traditional opiates at all, like radiation burns and even CRPS, which is chronic regional pain syndrome, otherwise formerly known as reflex sympathetic dystrophy. Now, as far as mood disorders and depression, people can get home-based prescriptive racemic compounded ketamine nasal spray that they can use at home, and even oral troches and tablets for maintenance therapy or even augmentation of your traditional medications that aren't working as well. So this is an option as well, and this is different than Spravato. Spravato is a S-ketamine, a single part of ketamine that is only used in the doctor's office, and it is FDA approved for treatment-resistant depression. And then there's also the use of ketamine therapies in the home front for augmenting psychotherapy. So individuals who are cognitively rigid and stuck in their therapy, the use of ketamine prior to therapy sessions can actually help open up those individuals and kind of crack the shell of their cognitive rigidity so they can kind of think outside the box and consider new ideas. Now, generally speaking, ketamine infusions are the most rapid way to treat an individual, and it effectively gives robust results and rapid results because IV therapies are 100% available immediately to the blood-brain barrier. And the images on the right represent a traditional ketamine infusion room in which the individual sits in a comfortable chair, generally in a somewhat darkened environment, and usually there's ambient lighting with ambient music, although most people do bring their own noise-canceling headsets and their own ambient type music. But generally speaking, a home-like atmosphere really helps as far as the setting is concerned to kind of allow the individual to ease into their infusion. And of course, ketamine ready-to-dissolve tablets, and these are examples of them up on the upper left-hand side, and on the lower left side are examples of what tablets look like. The individuals will put these under their tongue, let them dissolve for about 10 to 15 minutes. The effects are seen within 15 to 20 minutes, and most of the time individuals will absorb between 20 to 40% of the given dose. And on the right is an example of a ketamine nasal spray bottle, and you can use this bottle to spray it into the individual's nose in a prescriptive fashion, or an individual can use, for example, a MAD 100 atomizer device to spray it in the nose to get a higher level of efficacy. And about 80% of nasal spray is absorbed in this fashion. And of course, this bottle over here represents IV ketamine, and that, of course, in the form of an IV is 100% absorbed, and the way that it distributes to the body is certainly a lot more predictable. Spravato comes in a single sprayer, such as the one in the middle. It's only administered in the doctor's office, generally twice a week for the first month, and then weekly thereafter. And that one requires you to sit in the doctor's office for a few hours, and then driving, of course, can't be done for some period of time afterwards. On the right here is an example of a ketamine troches. These are basically a little bit harder in their format, whereas the ready-to-dissolve tablets are more chalky and they absorb a little bit more quickly.